Hi, everyone. Thank you so much for joining us today for our finalist webinar number 1, featuring our consumer wellness, consumer prevention, and employee prevention and wellness categories. We are so excited to host all of these wonderful companies today and to have all of you in our audience. I will now turn it over to Matthew Holt, one of our executive producers, who will be leading this session.
Hi, I'm Matthew Holt. I am not only an executive producer at the UCSF Digital Health Awards coming up on November the 14th at Health. If you haven't noticed the background, also run the healthcare blog, and I used to do the Health 2.0 conference. I do a bunch of stuff and I hang out with startups a lot. And we have really great sessions. We're going to do this in 4 parts, right? So we're going to start off with the best in-class finalists. These are the bigger companies in consumer prevention and consumer wellness. I've bundled those together because I don't know what the other difference is between them. And we're going to go right around. There are 8 of these companies, and they are just going to go, and each of their representatives is going to tell us who they are, what they do, and why they're so great in just 30 seconds. Starting with Marina at Welldoc. Go.
Hi, I'm Marina Dortheo, Chief Marketing Officer for Welldoc. Welldoc is a chronic care digital health company focused on cardiometabolic conditions and comorbidities. Our flagship product is Blue Star, and it's FDA cleared with 9 FDA clearances for type 1 and type 2 diabetes.
Fantastic. Jason.
Hi, I'm Dr. Jason Plethy. I'm the medical director at Lark. Lark uses conversational AI to coach for healthcare conditions such as diabetes, heart health, and hypertension. We do this at low cost and very high scale. And so we work with health plans to engage and increase access for their members.
Wonderful. Next is Omada.
Hi, everyone. I'm Ryan Kwan, Director of Data Science at Omada Health and co-founding member of the Insights Lab. Omada Health delivers integrated virtual care across chronic conditions, the top clinical need for employers and health plans. We combine clinical best practices with the science of behavior change, delivering personalized interventions for diabetes, diabetes prevention, hypertension, musculoskeletal issues. My role is to deconstruct the Omada programs and identify which components are leading to the best possible engagement outcomes possible so that we can build it better.
InterWell. Doing InterWell? In the case, Embr Labs.
Hey there, man, it's Bobby from InterWell Health. Someone turned off my video.
Oh, turn on your video.
I'm trying. It's you guys turn it off for me.
Okay, I'll try and find you and turn you back on.
Great. Perfect. Hey there, Bobby Sapuka, CEO of InterWell Health. InterWell is a company that's about 8 weeks old, having been born through the merger of my old company, Cricket Health, with the population health arm of Fresenius Medical Care and the largest network of nephrologists in the country called InterWell. Together, we're transforming kidney care. We work with payers and health systems to identify patients early before their kidneys have failed. We partner with nephrologists across the country to provide better care for these patients. We help them slow progression of the disease. And for those patients who do progress, we keep them healthy at home and out of the hospital.
Fantastic. Elizabeth. Elizabeth, unmute. There's always one.
Hi, everyone. I'm Elizabeth Gosd. I'm the CEO of Embr Labs. We produce this beautiful wearable device that you see here that uses temperature as a new pathway to the brain to help with hot flashes, sleep, and stress. We are addressing a huge unmet need, which are the 1.1 billion women globally suffering from menopause.
Ovia.
Hi, nice to meet you all. I'm Mackenzie Curran. I'm the Director of Marketing here at Ovia Health. Ovia is a women's and family digital health solution, and our goal is to make a happy, healthy family possible for everybody. What that means is helping our members meet their health, family building, pregnancy, and parenting goals through predictive health monitoring and personalized guidance from our care team. And I'm not just an employee, I'm a member as well. I'm around 5.5 months pregnant with my first, and it's been an invaluable resource for me.
Fantastic. Lexie.
Hi, everyone. Really nice to meet you. My name is Celine van der Vat. I'm the COO at Lexie Hearing. As Lexie, we build smart audiological health tech that aims to democratize and decentralize hearing healthcare provision worldwide. Our tech helps or aims to help the 466 million people suffering from hearing loss worldwide with OTC hearing aid tech and remote expert care that stands them in good stead to be connected with their families, their communities, workplaces, empowering them to better health and better life outcomes.
Fabulous. Everyone obeyed the instructions very well. Is Zocdoc here? We seem to be missing Zocdoc. Zocdoc is the aid firm. They're in the consumer wellness category.
You're not joining today.
I'm not joining today. They are in the businesses. They're an old world digital health company from back in the early days, and they're in the business of physician appointments. Wide variety just in our established companies here. And some of your companies been around a while. Some of you, like Bobby at InterWell, are now part of a much bigger organization. Obviously, the Omadas and the Welldocs been around since the early days. Lark Health was on a Health 2.0 back in when I think Julia was on stage in 2012, maybe introducing it. So this is like sort of the old guard of digital health almost. And I guess the big question I want to start with, and you will raise your hand to come in, but if I don't have to pick on somebody, is who is the end buyer for this stuff eventually? Obviously, there are direct consumer players in digital health. There are employers and plans and pharma and who knows what. Who's the end buyer? Someone wants to jump in.
I can go first. I don't mind. So our end consumer, we go direct to consumer by putting an audiologist and audiologist quality hearing aid fitting in somebody's pocket on a smartphone, and have been doing so for 2 years. And with the recent OTC regulations that went live a week ago, we've been able to we've been waiting for 2 years to see whether or not people are actually going to absorb this technology, consume it, and we have been overwhelmed with the support in the last 10 days, and it's totally changed our company, up 820% in revenue in the last week, which is absolutely fantastic. So our end consumer is anybody with a mild to moderate hearing loss, typically over the age of 50, but our hearing aid wearers are 9 years younger than the average hearing aid company to date.
Good answer. Bobby.
Yeah, we work with plans and systems. We have more than a dozen contracts with large national payers and regional health plans. We also work with primary care providers who are responsible for this complex kidney population, but don't have the means or wherewithal to improve the health outcomes. I think in short, you could say we work with anyone who's at risk for this population, but doesn't want to be. We also partner with nephrologists to participate in CMMI's large kidney care choice model, which is the shared savings program for late stage kidney patients. And with more than 25 sites across the country, we're the biggest participant in the program. So all told, we manage more than 125,000 patients and have more than $6 billion in medical spend under management. And we do all of that profitably. For us, it's about who's at risk.
Bobby, is that because kidney patients are too complex, too difficult to have a sort of direct consumer play, whereas hearing aids, hearing and maternity might be different?
I think it's exactly right. I think part of the problem here is it's a very and underdiagnosed disease. So you've got a lot of patients who actually don't even know they have the disease. And then, oh, by the way, it's so, as you said, so complex and so difficult to treat. It's really about going upstream to the payers, to those who are at risk. That's how you're going to have the impact.
Ryan.
Yeah, so today, Omada delivers integrated virtual care across chronic conditions to members with diabetes prevention, hypertension, musculoskeletal issues. We work with over 1,700 customers to distribute our products, including health plans, health systems, employers, ranging in sizes from small businesses to Fortune 500s across a variety of industries. But I think your question is who will eventually buy our stuff, right? So let's fast forward 5 to 10 years from now. And at this point, I think a lot of virtual care providers should have generated large enough data sets, large enough volumes of longitudinal data on the patient journey happening in between doctor's visits. So where the definition of stuff isn't just limited to these opaque programs running course of months to change clinical outcomes, but actually really precise interventions running in the course of days to change health behaviors more specifically. So for a cohort of patients who are 40 to 50-year-old shift workers with high motivation living in an area with low walkability scores, we should have generated enough evidence that a specific sequence of interventions, right, educational content, coaching strategies, can actually have a high probability of driving the average number of steps taken over the next 7 days. So stuff isn't just a program that you contract for once, but rather a collection of repeatable and reusable behavior change playbooks that are validated and shareable. So who will eventually buy our stuff? I actually think maybe all the people here at this very table, because if you can discover a behavior change playbook that works well for population A, and another, let's say McKinsey finds a playbook that works well for population B, why not create a marketplace of ideas where these playbooks can be exchanged so patients can collectively benefit as well?
Fabulous. Elizabeth.
Today, we're serving a massive population. As I mentioned in my introduction, we're talking about 1.1 billion women globally in menopause who can't sleep, who are having hot flashes day and night, and are now choosing to step out of the workforce. These are our most enthusiastic customers, but we also know that men have hot flashes too. We discovered through customer feedback that men undergoing prostate cancer treatment can experience upwards of 100 hot flashes a week. And so we've also proven the product's ability to address that. In the future, we will be serving the general population in sleep and stress, both global pandemics.
Okay, and who's paying? Consumers direct, or you think this
Consumers are paying direct, yes.
Okay, interesting market. Mackenzie.
Our buyers themselves are large employers and payer organizations, and they offer Ovia as a covered benefit at no cost to their members or employees. We also have a free version as well, so we are a little direct to consumer. At the end of the day, though, the goal and the center of everything we do is the people who use our solution. To us, those end users, they're who matter, and we're doing everything we can to make sure we're creating a solution that helps them meet their goals, whether that's managing a condition like PCOS, endometriosis, menopause, or maybe they're trying to build a family or manage a pregnancy, especially if they're high risk like I am, or just keep it all straight when you have children, a career, and the pressures of the post-pandemic world weighing on you.
Great concept, but it's an employer product used by consumers. Jason, what's your answer for Lark?
Yeah, so Lark works with some of the largest health plans in the US, and we support all lines of business, commercial, Medicaid, and Medicare Advantage, and also working directly with large employers. And the idea is that, yes, our end users are also the members, and they're getting the Lark health coaching for free. You know, I'd say that everyone could benefit from a health coach, help us eat better, exercise more, and navigate the healthcare system. And so Lark uses conversational AI to do that at low cost and at scale. So to date, we've helped nearly 2 million people manage and prevent their chronic conditions, and we have over 30 million more managed contracted members that do have access to Lark. So the idea is that our conversational AI is available 24/7 to patients to give them that immediate coaching on demand, to gather insights from their connected devices and so forth, and really coach them on what they should do with a high blood sugar or on what they ate during that day, help them drive those behavior changes, those little things that add up each day, and ultimately drive those improved outcomes and do it by decreasing the lower total cost of care.
Excellent. I think last but not least here in this section is Marina.
Hi, Marina from Welldoc here again. So we have a diverse customer base across health plans, health systems, along with pharmaceutical, life science, medical devices, durable medical equipment companies. And I think in answer to your question, chronic care is complex. You need a multitude of different solutions to solve for it. And so we believe flexibility and clinical validation is the center of it. And so as we can integrate with all of these different models, and we can help optimize and really develop really complex solutions for our complex chronic conditions. So we don't think one size fits all, and that's why we need that diverse model of customer base.
Okay, so it's not that you didn't give me one answer, even though you are the consumer prevention and consumer wellness panel. I would ask you if there was a difference between consumer prevention and consumer wellness, but that's really a question for Mark and Melissa in the UCSF team. I don't think there is much of one, but there we go, which is why I crammed you all together. Okay, real quick, we've only got 3 or 4 minutes left for this section, but there's been a lot of back and forth about value and ROI and all kinds of big words. My bias is that in the healthcare system as a whole, no one really cares about value and ROI. They say they do, but if you look at the way money gets spent across the healthcare system, we don't. But digital health companies get held to a higher standard. And then if you look at the most successful, fastest growing digital health company ever, which was Livongo, they didn't really have much in the way of data about how great they were, but they had a great customer experience. So I just want to pick 1 or 2 of you. What matters more? Is it more about improving the overall customer and patient experience, or is it really about delivering ROI? And which are you feeling pressure about that? Who wants to answer? Okay, Marina, then Mackenzie.
Yeah, I think unfortunately it's both, right? You have to delight and make this seamlessly integrated into the consumer's daily life in order to actually show value. So that has to be the heart, and I think is the heart of what we've heard everyone say. It has to be about that experience. If the experience is real and it's concrete and it's helpful, then it has to then integrate with care. And so I don't think that digital health happens in a silo. It has to be part of that larger ecosystem. So those health outcomes that everybody's being held to shouldn't just be on digital health. It should be on care. And so how do you leverage digital health to really truly optimize and impact that to show those health outcomes? Last thing I'll say, it's a journey. We know that these conditions are complex, they ebb and flow. And so part of that day-to-day support is really supporting that integration into care and recognizing that it's not a one-to-one and it's not going to be one and done. And I think digital health can start to expose some of those gaps in care to really, really show that.
Very awesome. Mackenzie.
Yeah, and I'd love to build on that. It's not just that these are really two mutually exclusive ideas. They really should be one idea, especially when you're working with a population at risk like ours is, and there are so many ways that things can go wrong. Your ROI needs to be tied with VOI, right? It has to have that value of experience as well as those outcomes. Those are just as important. And when you have better outcomes, your experiences should hopefully improve as well, but they are very intertwined. And as an organization that's built on science and clinical evidence, actually around 10 years of claims data and counting, we're always investigating to see what, is impactful for our members. So for example, if we were able in a recent independent third party study to see a 54% reduction in preterm births, that's not to us just a number. That's really somebody's value of their life, of their child's life. And those real outcomes are the things that change the future health of a generation. So that's what we want to measure. That's what matters to us.
Fantastic. All right. We have 2 minutes left. I want to try and fit 4 of you in. So 20 seconds each from Ryan, then Elizabeth, then Celine.
Ryan, Omada Health. I think everyone's calling the right shots here. It's both ROI and value, but the question is, like, with virtual first care companies, we're generating a lot of new data, right? New measurements to actually understand what does value actually mean for our members and how do we actually connect that to ROI. So what I would expect from this panel and a lot of customers here is to start publishing more research on the new measures that we're starting to develop when it comes to understanding value, health for members, and connecting those directly to claims and seeing how those are actually contributing to improved ROI. And I think that's what Omada is doing and what the Insights Lab is working on right now.
I love it. Every medical journal ends up more research is needed. Great. Okay. Celine and Elizabeth, and I think that's the final word. So Celine, quick.
Awesome. At Lexie, we're the most data-rich and research-heavy audiology company in the world. Because we believe in data integrity and the value of such data. It has to be driven by customer satisfaction and health outcomes. And in one of our most recent studies comparing customers fitted with our OTC Lexie hearing aids and those fitted by HCP shows that not just is our consumer outcomes comparable, it outperformed the traditional model in 2 of the largest areas. As for ROI, the OTC market for hearing aids will be as large as the traditional hearing aid market in the next 3 years, so 4 million units per year. And as Lexie, we expect to be in the top 2 providers of that, taking at least 30 to 40% of the market. So I think the 2 things can happen at the same time, but it has to be driven by data and science.
All right. Fantastic. Last but not least, Elizabeth. No one else going to have a chance because we're running out of time, but Elizabeth, quick.
Thank you. Embr Labs again. We look at value very simply. Are people taking money out of their pocket and spending money on our product? And are they using the product? And we see that our women are using the product for 5 hours a day. So that speaks volume to not only value, but ROI.
I love it. The consumer paying cash must be happy. So that's a great way of describing it. Fantastic. All right. That was the best in class finalists for consumer prevention and consumer wellness. Congrats to all 8 of you, and only 7 you showed up. It's Welldoc, Lark Health, Omada Health, InterWell Health, Embr Labs, Ovia Health, Lexie Hearing, and Zocdoc who weren't here today. And that is fantastic. So thanks to all of you. Virtual round of applause from all of our participants, from all of our people watching. And now we're going to do the big switch. And we're going to bring in the Rising Star finalists in this category. So please, if you're in this group, turn yourself off. If you're in the Rising Star, turn yourself on. And we're going to do the same 60-second intro. We should have, I believe, 16 of you. And I'm going to call out by company and hope I get this right. The first one up is, all the way from Israel. It's Cardiokol. Do I see James there? James, you there? May have gone to sleep. We'll put James at the last if he shows up. Okay, the Kit Company is next.
Yes. My name is Eric Salazar, co-founder and CEO of Kit.com based in San Francisco. So Kit is a provider of at-home health testing. Historically, people would go to LabCorp, request for the lab draws, And now consumers are leveraging companies like Kit to provide a premium at-home experience for testing. So what makes us unique is our ability to push the envelope on the type of tests that are available and possible through this modality, while also maintaining a strong clinical accuracy not previously seen in the industry. So you can go to kit.com or also visit our parent company, which recently acquired us, Ro, at ro.co. Thank you.
Wonderful. Chrissy Rowe is still splashing the cash out in digital health. Next is Viocare.
Hi, I'm Rick Weiss, president, founder, and my favorite title, Chief Wellness Engineer at Viocare. We're located in Princeton, New Jersey. We're a digital healthcare company that helps providers help patients eat better, prevent or help manage their chronic disease. Through our innovative and scientifically validated bioscreen, dietary assessment, and precision nutrition feedback technology. We help everyone at all stages of life to prevent disease, and those who already have a nutrition-related chronic disease or other diseases with a diet relationship, something like cancer. Thank you.
All right, fantastic. Next is Outcomes for Me.
Hello, I'm Maya Saeed. I'm the founder and CEO of Outcomes for Me. Outcomes for Me is Boston-based. We help cancer patients take a proactive approach to their care by providing them the tools and resources necessary to navigate their care. Through our AI-driven patient empowerment platform, we provide personalized treatment options, empowering them with both evidence-based and oncologist-approved information and resources. Our mission is to democratize healthcare and deliver on the promise of precision oncology by ensuring every person diagnosed with cancer, wherever they are and whoever they are getting the best care possible and enabling the rapid dissemination of innovation. And thank you for having me.
Thanks so much, Ryan. Nice to see you again. Okay, next up is Intellihealth.
Hi, thanks for having me as well. I'm Dr. Catherine Saunders. I'm co-founder of Intellihealth, and I'm the leading expert in obesity medicine. Intellihealth is changing the perception of obesity and redefining how this disease is treated. We offer a clinically proven medical obesity approach that's 3 times more effective than lifestyle interventions alone. Our product, which is called Evolve, enables healthcare providers to offer medical obesity treatment. We also have a clinical services affiliate called Flight Medical that provides businesses and healthcare systems the services of experienced clinicians who are experts in obesity medicine, including physicians, nurse practitioners, and registered dietitians.
Excellent. CancerIQ? Ooh, no CancerIQ. GaitBetter? I see Craig there.
Hi, my name is Craig Hillman. I'm the Senior Vice President of U.S. Operations for GaitBetter. GaitBetter leverages the concept of motor cognitive reserve to bring about really a revolution in fall prevention, cognitive health, and the ability to detect neurological indications such as Alzheimer's or Parkinson's far in advance of existing techniques. We utilize a semi-immersive virtual reality to introduce simultaneous motor cognitive training while walking on any treadmill. And the outcomes are nothing short of outstanding. We reduce falls by more than 3 times greater than existing interventions in time periods as short as 5 weeks compared to upwards of 6 to 12 months. By some measures, we reduce falls at a cost greater than 50 to 1, less than existing interventions.
Excellent. Gabbi. The room goes quiet. We have no Gabbi. Playback Health. Greg.
Hey, thank you, Matt. I'm Greg Odland, CEO and co-founder of Playback Health. Playback is a B2B point of care communications platform that connects providers, patients, and loved ones to the point of care so that everyone can hear firsthand what it is that the doctor said. We empower clinicians with everyday communication tools to securely share medical information with their patients and know that their care instructions are being heard and followed. Patients are able to hear those care instructions over and over and share them with loved ones so that they know they're not alone.
Wonderful. And my name is Greg Orr. I'm with Jasper Health. I'm a COO of Jasper Health and run the company together with the CEO. Jasper is a hybrid digital and human platform that helps and assists folks that have been diagnosed with cancer, their caregivers and families. And we focus on the psychosocial aspects of that entire treatment journey, especially from initial diagnosis all the way in through remission and beyond, selling primarily to payers and employers and health systems as well. Wonderful to meet y'all.
All right, fantastic. Nymbl.
I'm Dr. Nathan Estrada. I'm the VP of Clinical for Nymbl Science. We're a validated digital balance training and mobility program that will prevent 1 million falls. It's an effective way of engaging both the brain and body together. And just using the existing smartphones that older adults already have in 10 minutes a day, allowing older adults to enhance their freedom and enjoyment of life by solving the #1 anxiety point of aging, declining mobility. Nymbl is a proven way for real people to see real lasting results with a 35% reduction in fall-related medical claims, among 26-fold higher engagement than in-person classes. Falling doesn't have to be a normal part of getting older, but using Nymbl probably should be.
All right, wonderful. Smart Nora.
Hi, everyone. My name is Behruz. I'm CEO of Smart Nora. We are disrupting the divorce market by letting people sleep in the same bedroom and avoid snoring. So we have a solution that's a contact-free solution for snoring. And also it has apnea applications that we should pursue. But we have bootstrapped to helping more than 130,000 couples get much better sleep. And we've been commercial for 5 years. Great to be here.
Fantastic. Radicle Science.
Hi, I'm Dr. Jeff Chen, co-founder and CEO of Radicle Science. We've created the new category of proof as a service, offering history's first easy path for non-pharmaceuticals to prove their true effects. We do this via automated, standardized, reimagined clinical trials, which are AI-driven, crowdsourced, virtual, and direct-to-consumer, enabling proof generation at unprecedented affordability, speed, and scale across diverse populations.
Oh, I thought you were going to say something else at the end. there was no conclusion. Great stuff. Rosy Wellness.
Hello, I'm Dr. Lindsay Harper. I am an OBGYN and also the founder and CEO of Rosy. Rosy is a platform that is dedicated to the 43% of women in this country who have a sexual health concern or problem, but we rarely ever talk about. Rosy provides evidence-based and expert-created education, behavior change, support, and community to help women solve these really important problems. We're now recommended by more than 8% of OBGYNs in the country, and we're thrilled to be changing the conversation about women's sexual health.
Fantastic. Diora Devices.
Hi, everybody. My name is Sydney Collin. I'm the CEO and the co-founder of Diora Devices. We give people with mobility impairments the tools to walk safely, independently, and confidently at home or anywhere. We do this with the NextStride, which is a research-backed visual and auditory cueing device that's integrated into a small portable device that can attach onto any cane, walker, or walking pole. Our cues have been shown to reduce falls by 40% for people with Parkinson's, but also have a number of efficacy studies behind them showing efficacy in stroke and cerebral palsy, multiple sclerosis, and a number of other areas.
Wonderful. And last but not least is imaware.
Good afternoon. My name is Dan Goldstein. I am the Chief Marketing Officer at imaware. We are solving the problem that 80% of Americans are metabolically unhealthy. We are doing this by providing a fully white labeled solution for every other company in this vertical to offer CLIA and CAP certified testing, and then integrate all of that information into your business model through full SOC 2 and HIPAA compliant APIs. We've actually found in our partnerships with 19 other companies in this space that times better compliance from their customers, as well as getting significantly better patient outcomes. The best part of our business model is these are expensive things to set up on your own. We have the capabilities to set these up in less than 8 weeks for any other company in the vertical, and it's something that we are excited to continue to work on.
All right, wonderful. There are a couple of people I think are in the wrong category within Zoom, or attendees, not panelists, and we're going to try and see if we can move a couple of them. Do we have Cardiokol? I think the other one we're missing was Viocare. Well, let's all tell me if we do. All right.
Added James as a panelist, so you should be able to.
Say that again.
Added James as a panelist from Cardiokol.
All right. Is James there from Cardiokol? Can we see him yet? Not yet. Switch your video on if you can, James, and I'll give you 30 seconds. It'll have to be at the end. Right. Now we're going to do, we've got, again, not a lot of time here. We've only got about 15, 16 minutes, and you count you, there are a number of you, so it's going to be a bit tricky. But I guess the question overall, the first question is going to be around, same as asked the previous group. Who is the eventual buyer of these services? And this may vary in different countries, may vary for different types of things. But and again, I want you to start putting your hands up, your little virtual hands up, as to who's going to be the buyer. Is this like when you're a consumer prevention product, is it a consumer or is it an employer? Is it a health plan? Is it a plan? Well, all right, I'm going to start with Greg and then go to Dan and Nathan.
Sorry, you meant Greg or Jasper, correct?
Sorry, Greg or.
I know there's
Greg or beat Greg Orvan, so well done.
Yeah, it's been very interesting. So in the cancer stage, we knew that cancer is relatively small prevalence, especially for like a commercial population. Obviously, big cost. So we initially really went out and started talking to payers. We thought, well, there's the aggregator that we're going to go after. But I'll tell you, employers are really they really do care about their employees. And when they hear, I think they feel very confident that when they send people to, centers of excellence, that they're getting the proper clinical care. The benefits manager and employers going on, how am I going to, I'm not going to give you advice on clinical care. But what they've realized is underneath that clinical care, when that person's at home and not in the actual office, they're living their entire life. So they're really discovering the need for the psychosocial coaching and especially like how they get back into the workforce. Like I want to help them get back into the workforce. It's already awkward. Your employer's not supposed to know your health history, yet you kind of end up having to tell them you have cancer because you're going into this treatment journey. And there's really nothing there to help them into remission. And once they're in remission, there's still, there's still higher claims costs, there's still concerns and those types of things. And so they're just elated when we start to bring in, cognitive behavioral therapies and things like that help them get back into the workforce and return to where they were. So it's really been employers that have been really, really going after us when we go through aggregators, generally like payers and TPAs and the like.
Okay, great. Dan.
Thanks, Matt. After about 3 years of selling direct to consumer, we've realized that the best way to get success in this space is the combination of science, better metabolic insights, the right experts to provide personalization, but really pairing it with experts who know the actual symptoms that they're treating, understand that actual business model, understand the consumer challenges, and they could ultimately build a business model that's part human, part science blended together. The reason we realized this was important is a consumer takes a test at home, they see results, they see numbers on a piece of paper, they don't necessarily know what that means. So for us, we've been trying to build an ecosystem that allows all of the great doctors in this world to get better access to what's going on with their patients, letting them get past the idea of just treating symptoms based on what's on the outside, but providing personalized care, helping them understand what will actually drive better results, giving better treatments that are more specific to that user. We know that those personalized treatments lead to better engagement, better outcomes. And for us, it's why we've shifted our business model directly from D2C to building a marketplace where any other company or any expert, whether it's a nutritionist, a influencer that has a really good point of view on fitness, to a doctor or a local firm, giving them the ability to provide personalized care, because that's one of the biggest challenges we see in this space. And one of the things that we believe if we unlock, it's not a one-size-fits-all solution. It's allowing every company on this call and every other company in this vertical to offer better care for their consumers, because that's what we chase at the end of the day.
Excellent. Nathan.
Yeah, mine's a little bit easier. We sell directly to Medicare Advantage plans and to government entities. Like the country of New Zealand just launched us as a countrywide program for the next 5 years. We're really B2B2C. We don't believe that older adults should ever pay for a service that saves an at-risk organization $15,000 when they don't fall. So anytime we can remove barriers from the actual customer, being the older adult, we should. So Medicare Advantage pays for what we do.
That easy enough. Catherine.
Great. I'm Catherine from Intellihealth again. So our customers are medium to large health systems, employer groups, payers, pharma companies, and actually just individual people. We basically started as a software company with our platform called Evolve that can be used by really any provider who wants to deliver expert, highly specialized obesity care with all of the support they need to get up to speed and then to deliver this care to their patients. But over the last few years, we had so many requests to just provide the care ourselves, since we are at the leading edge of this field and we're the long-term experts in this field. So we launched launched our affiliated clinical services called Flight Medical, where we can provide everything that's needed to employer groups, also to medium and large health systems, and different types of customers ourselves. We have everything that's needed to deliver the best in class obesity treatment in a box.
Catherine, obesity is one of those categories where there's a ton of direct to consumer and people understand that. And, is it really a disease? You're going to get that from a lot of, I won't argue with you about that question, but, so why do you think that route rather than going by consumer is going to be the way to go?
Great question. I mean, given the magnitude of this epidemic, our plan is to really power existing infrastructures instead of seeing patients one by one.
Fair enough. Okay. Next up is Maya.
Yeah, so at Outcomes for Me, our mission guides the business model. What I mean by that is our mission is to improve outcomes in cancer by democratizing healthcare and deliver on the promise of precision oncology. The minute we talk about democratizing healthcare, we have to be direct to consumer and free to patients. Otherwise, there's no way we're going to democratize healthcare. So that's the free on the direct to consumer channel. And then the minute we talk about delivering on the promise of precision oncology, so rapid dissemination of innovation, our business is focused on the life sciences. And essentially, it's really around rapidly disseminating the innovation. What that means is it includes accelerating clinical trial recruitment, which is a win-win both for the pharmaceutical companies, but also, and more importantly, for the patients themselves, especially in the metastatic setting. Clinical trials are often the best treatment options for patients, their best chance. We also have a partnership with diagnostic companies around disseminating the importance of genomic profiling, genetic testing. All this unlocks new therapies. And finally, we also do partnerships with pharma companies around precision contact education, really helping patients have the right information to take a proactive approach to their care.
No, that's a great point, Maya. I mean, if you have direct to consumer is all very well for a product that consumers pay money for, but if you want to really democratize it to everybody, a lot of sick people don't have a lot of money, and especially in cancer, as we know, the impact of cancer in the US, particularly on people's pocketbooks and bankruptcies, is horrendous. So
it's two things that are important. It's the free channel and the direct to consumer, because the minute you go through an intermediary, be it a payer or an employer, you're de facto excluding a portion of the population.
Amazing. Sydney.
So we really go after the consumer, actually. We do sell to physical therapy clinics, skilled nursing facilities, hospitals. And the reason that we do that is that they already see the benefit, right? They're already using visual auditory cues, and we give them a tool to be able to do this easier. For example, Bellevue Hospital came to us within a couple months of getting our device out on the market and said, hey, we've been using parallel lines of tape on the ground, but it's such a struggle for our PTs to have to put the lines down and then pick them back up and put the lines down again. And we had a way for them to make this easier to use with a green laser line rather than lines of tape on the ground. But the real impact that we have that people don't have access to, because people have access to these visual auditory cues in the clinic, they don't have access to them at home. And the impact is, for example, for Jack, the person I made this device for originally, this device is the difference of him being able to walk to the bathroom by himself or not, of him being able to go for a walk with his wife, Sandy, or being stuck in a wheelchair. And that's the impact that we want to have. And that's why we go after consumers. So end users are the consumers for us.
Awesome. Great.
So it really depends, Matthew, whether you're talking about intervention or prevention, right? So when we're talking about intervention, we're talking about somebody who is at risk for a fall. We don't want that person kind of training on their own, because we don't want somebody falling when we're trying to prevent them from falling, right? So when we talk about intervention, we sell a system to healthcare systems, especially those that are hopefully value-based, where they see financial benefit when their patient outcomes improve, as well as senior living facilities. And then if we're talking about prevention, right, somebody who is still walking, right, but as you probably know, over 75% of first-time falls were never identified as a fall risk to begin with, right? Then we want looking for older adults who are kind of still in the community, still kind of mobile, but they're worried about their long-term health, both from a falls mobility as well as a cognitive. Then we're talking about gyms, fitness centers, and eventually into the person's home.
All right. Lindsay, you're next.
Thanks, Matthew. Yeah, so I'm Lindsay from Rosy. Working in women's sexual health is a unique field, I would say, and the challenges are many. But in this conversation, we face challenges as physicians where we don't get reimbursed for these women's sexual health oriented visits. The pharma, the F2 FDA approved medications in this space are also not covered by our payers. So the onus is on us not only to create this space, and so in order to have a business model that was viable, we had to go direct to the consumer. But like many other women's health companies who are really, trying to disrupt the way that we understand healthcare as women and the way that our healthcare serves us, we are also obligated to generate and create the data that supports the work that we're doing so that then we can go and convince these other stakeholders that yes, you should be covering this as a routine part of healthcare. So it's exciting, now that we're 3 years in, to be seeing interest from other stakeholders like pharma, like diagnostics, like systems, who are starting to recognize, because of the investment that we put in on the front end, how important these services are to the patients that they're serving.
Fantastic. Okay, last in this section is going to be Behrooz from Smart Nora.
So I think we are one of the more straightforward here. That obviously the pain point is more acute for the snore victims. So they're the one that usually take action, but it becomes then a benefit to sleep of both partners. Would definitely love to connect with everyone here and learn more about employer channels, because we know the ROI of a sleep is very clear now. So in any given company, 40% of your employees would benefit from reducing snoring. So definitely a kind of a place for us to develop.
So, Behrooz, you've probably heard about drug companies who pay generic competitors to not go onto the market. Is there a set of divorce lawyers who are paying you to not sell your product? You should think about it. All right. Real quick, we're going to go to the other section. But in the meantime, we have James from Cardiokol, who has now emerged from the pack where he is. So, James, you have 30 seconds to tell us about Cardiokol.
Great. Thank you very much, everybody. My name is James Amiot, and I'm the CEO of Cardiokol. So basically what we do is we develop vocal biomarkers to save lives, starting with AFib, atrial fibrillation. So voice, as you well know, is not just words. It's a result of a physiological process generated in our body containing valuable data about our physiology and health. So our vision is developing apps that use voice as a kind of a preventive pill to save lives. So imagine it as your personal guardian watching over your health. Thank you.
Fantastic. And James is one of the groups in the Bayer G3 that I know a bit because of my connection with Bayer, and they're doing some interesting work. A lot of interesting stuff there, but medical devices are sort of fascinating direct to consumer. So why don't we start on the next question, which is around the issue of, and some people have said, who the hell is this Al Lewis guy I quoted in the question? So Al Lewis is a guy who's been looking at consumer wellness apps, employers, self-employers, and has been sort of really going off their ROI or lack of it. And I always sort of say, well, that's fine, but let's look at the rest of the health system. It doesn't have great ROI in many things it's doing. But I mean, I guess, it's good that we're all being asked more about ROI and about that stuff. But I want to know, what's your view about how important it is to this category in your business? So why don't I start with you, Rick?
Great, thanks. Hi, it's Rick Weiss again from Viocare. So I know Al and talked to him many times over the years, but not recently. But we do have proof that our stuff, BioScreen, does work. And our main difference is that when we collect our dietary information, we generate really precision feedback, not just summary stuff on the high end. And one of the reasons we can do this so effectively is that we added 1,500 food picture size, portion sizes in the technology itself. And the output is this precision nutrition that it generates these highly personalized, actionable dietary nudges. And nudges is kind of a key component of this. So it's not generic. It gets down to very specific things, like if you have a low fruit score, 2 out of 5, and you eat 1 apple per week, we may nudge you to say, hey, maybe you can eat an apple 3 to 4 times a week. We provide like 20 of these nudges, and we suggest that you choose 3 of them. Geisinger recently completed a 3-month study using our system on 200 hypertensive patients. Patients' blood pressure dropped by about 6 points. I lost about 10 pounds. And the published paper from the study that just got published in the Journal of the American Heart Association noted that the magnitude of the improvement in blood pressure was substantial, similar to medication and in line with much more resource-intensive feeding studies and lifestyle intervention trials. So perhaps the best proof is that after 5 years of licensing our tool in the clinical market, we have over a 95% retention rate of the providers that use our system. Thanks.
Great. Great.
Hey, thank you. Yeah, so Playback is a B2B SaaS platform. So we sell to care providers who want to better communicate medical information and care instructions to patients. Patients, families, external providers are free. We see healthcare through a fairly simple lens. What do care providers want? They want their care instructions heard and followed. What do we as patients want? We want to hear those care instructions in a language we understand and are able to easily share it with others that need to know. The idea behind this, the ROI behind this, is that when patients feel cared for, you can grab these scores through patient experience scores and otherwise, really good things happen. Adherence improves 62%, hospital readmissions fall 39%, and medical bills are on average 52% lower. So the idea here is make care communication simple, easy, more transparent, more accessible, and we solve a lot of problems in healthcare.
Excellent. Okay, we're running end of this section, but real quick, I think we have time for Eric, Jeff, and Dan, but 20 seconds each, guys. ROI matters.
Thanks, Matt. So Eric from kit.com. In the case of at-home testing, the big elephant in the room for us has been Theranos. But what we're doing is quite different. They're focused on one-drop analyzers that didn't exist and still don't exist. And so for KIT, a hyper focus has been on the patient experience where the active self-testing, including blood collection, is done through an on-rails guided app experience in minutes, sample stability over the mail, FDA compliant medical devices, and perhaps just as importantly has been our clinical rigidity with outside peer review, rigorous inspections and certifications, using best-in-class analyzers. In fact, we use the same analyzers that are at UCSF labs. We're just down the street from UCSF Benioff, and our lab supervisor is actually previously a lab supervisor at UCSF. So we know that we're doing the right things to do the best by the patient. Thank you.
Jeff.
So at Radicle Science, our clients are any non-prescription consumer health product that's being sold but needs proof. So since launching last year, we're only serving the $50 billion dietary supplement space in America, but we've already studied 20,000 participants. And our platform expands perfectly to serve everything we've heard on here, from food interventions to consumer devices to digital therapies. Most of these products are unpatentable, can't justify the cost and expense of a traditional trial. But we've transformed a complex multi-million-dollar multi-year process to a turnkey 5-figure 180-day experience. And our proof as a service supports clients throughout their entire life cycle. Proof to create the most effective product possible. Proof to sell their product with strong, defensible consumer health claims. Proof to win over healthcare providers and proof to retain customers. And our radical vision is a future where large-scale proof transforms these consumer health products into precision, democratized medicines without gatekeepers.
Sounds easy. No, it sounds very hard, but sounds very impressive. All right, last in this section, I think, is Dan.
Hey guys, I appreciate it. As I am Dan Goldstein from imaware, one of the best ways that we can think about ROI is helping our B2B partners actually get better client results. For us, the best feedback is when we hear our clients are growing and they are scaling. I just want to share some quick stats from one of our partners, LO Health, which offers personalized nutrition, helps to grow. We actually provide all of their backend lab testing, API work. For them, they've been able to scale rapidly because they've been able to focus their efforts on things that they're best at, giving great care, and letting us focus on the parts of their business that they necessarily don't want to scale, building testing, building the APIs, building the backend integrations, supporting customer service, building up that doctor network. And I think for us as a company that supports B2B businesses in this vertical, seeing our companies grow and seeing them get better patient results is the ultimate outcome.
Okay, I think that's a great. That closes this section, except for one little thing. Eric Zimmerman was getting on a plane, and he's on the plane and could talk to us. So, Eric, you get to open and close this section with 30 seconds. Oh, sorry, with 30 seconds on yourself and your company right now, and then we're going to close this section. So, Eric.
Awesome, Matt. Thank you so much. And yeah, this is just fooling you because I got the background up and I'm sitting on a plane. Yeah, I'm with Kumanu. We are really closing the gaps in well-being by approaching things fundamentally differently. The proof is really in the North Star metric of our business, which is sense of purpose, that 1,000 peer-reviewed studies says does good things for us biologically and psychologically. And the outcomes we're focused on are really around burnout, people's willingness to stick around in a moment of quiet quitting and noisy quitting, and more serious mental health outcomes as well. And in a study that did have a control group, which is hard to do in this space, we were able to show reduction in depressive symptoms. And most importantly, we're really closing the gaps that are left by the common methods. And, you know, I'd say the best piece of proof is that I think Alois actually likes us. Just joking there, Matt, but thanks for having me. We're excited to be here.
All right, that's exciting. That's Eric Zimmerman, who's been around this space for a long time in health and wellness at Rubrik and elsewhere, and been helped people know a few times back in my day at this new company, Kumanu. And that is the end of the section, which is called Rising Star Finalists from Consumer Prevention and Consumer Wellness. And there were a hell of a lot of you. And thank you all for being brief. And I think we got everybody in who was here. So well done. Great section. And looking forward. These are two separate awards that will be coming up. Congrats to you, Rising Stars. And we are going to move right along. We're now heading to employer prevention and wellness. And this is the easiest section coming up because we only have 4 companies, which are almost nothing. So hopefully we have Quit Genius, Capital RX, Maven, and Virta on here. Eric, you can switch your camera off now and run away. And I see Capital RX and some others. Okay, that's good. So why don't we start in the order we are supposed to go in? Do I have Quit Genius? I think we have Quit Genius coming along.
Yes.
All right, fantastic. Okay, so we start off as the other sections, a minute each from you, 60 seconds only. In the order we've written down as to what your company is and who it does. And these companies are a bit better known than some of those rising stars and usually raise rather more money in some cases. So let's hear from you, starting with Quit Genius, and name and serial number, please.
All right. I'm Yusuf Sherwani. I'm the CEO and the co-founder of Quit Genius. And we're on a mission to help 100 million people conquer their substance addiction. I guess the big question is how we'll do that. And we're doing that by building the world's first virtual clinic for multiple substance addictions, including alcohol, opioid, and tobacco use. The way the program works is quite simple, really. We've not reinvented the wheel, but instead are reimagining how rehab should be delivered if it were invented today in the 21st century to overcome the stigma and get people the care they need. And we do that by combining human clinical care in the form of a network of drug and alcohol counselors, physicians, addictionologists, and nurse practitioners, alongside digital cognitive behavioral therapy, connected devices, and end-to-end medication management and fulfillment.
Fantastic. And Yusuf, how much have you guys raised? I know you're based in the UK and I know you're all over the place, but.
Yeah, well, we're actually raised in New York now, despite the accent, but we've raised about $100 million. And we're actually at 750,000 people who have enrolled into the program and benefited from Quit Genius. So a number I'm incredibly proud of. Still a long way to go to the 100.
Well, it's 750,000 out of 100 million, you just said, right? So you got a way to go.
Yeah.
That's 99,250,000 to go, but never mind. All right, fantastic. Next, I think is Sarah Izadi. Did I get your name right, Sarah, from Capital RX? And I don't see AJ, which is a big improvement. Oh, kidding.
I'll let him know. Hello, thrilled to be here. Sarah Izadi, SVP of Pharmacy and Head of Clinical at Capital RX. I also happen to be a UCSF alumni, so special moment. Capital RX is the fastest growing pharmacy benefit manager, or PBM, in the US. Our mission is to change the way drugs are priced in patient service to create enduring social change. And we do this via 2 main ways. We have created an ethical pricing models where we do not make money on drugs. Through our pricing models, we allow buyers, who are the employers and the patients, to communicate directly with the sellers, who are the pharmacies. We also deliver our services through a modern API-based platform called Judy. Judy is the brains behind our company, and it integrates seamlessly with member apps, and it really gives patients autonomy and streamlines all of our various workflows.
Excellent. So yeah, Capital RX, and I was kind of kidding. AJ Lucano, your CEO, has been just a little bit outspoken about the PBM business. And I think, you know, the PBMs, the big guys are going to be finding themselves under some heat for the next little bit as and folks like you, and it's not just you, there are some others playing in this space as well, coming up with ethical pharmacy benefit management. When I was growing up, they used to be called ethical drugs, and they're different things. But anyway, all right. Chris from Maven.
All right, well, thank you so much for having us today. So my name is Chris Hicks, and I'm the Senior Vice President of Employer Growth at Maven Clinic. Maven Clinic is the largest virtual clinic for women's and family health. We offer continuous holistic care for family building, pregnancy, parenting, and most recently, menopause. We were founded on the belief that women's and family health has been vastly underserved. Far before the overturn of Roe in recent months has put our work very much into the spotlight. Our mission is to change the health of the world, one woman, one family at a time. And since 2014, we've pioneered a new category and care model, which is grounded on personalized care advocacy, 24/7 access to a network of women's and family health providers across more than 30 specialties, clinically approved curriculums, and flexible reimbursement and financial tools. And today, our award-winning digital programs are trusted by leading employers and health plans to reduce costs and drive better health outcomes for both parents and children.
All right, I will not say the same rude things about Kate Ryder I just said about AJ Lucrena, but your CEO has been great. And by the way, minor political point, we're supposed to be political here. One of the few CEOs in healthcare at all who came out about the Roe decision as loudly as she did, and I really appreciate what Kate did. And as well as the excellent work she's been doing actually in Maven. All right, last and definitely not least, and we replaced the rather dodgy Finnish guy who usually hangs out from Virta with Paul. Paul.
I'll tell him you said that, Matthew. Good to see
you.
you.
He knows what I think about him.
Well, it's nice to see you and thank you. My name is Paul Sitzma. I lead corporate marketing and communications at Virta Health. Our mission is to reverse type 2 diabetes in 100 million people. We help people reverse type 2 diabetes using nutrition and continuous technology-supported care from medical providers and health coaches. So if you're a patient, it means you get to improve your blood sugar while actually reducing the need for medications. And more importantly, it means that our patients are getting their lives back and doing the things they love. For the more than 300 healthcare payers we currently work with, they save money. We put our fees fully at risk based on outcomes and deliver over $400 in savings per patient per month. That's about $10K over a 2-year period based on a reduction in pharmaceutical and medical spend.
Fantastic. And I think Virta is interesting. And remind me, Paul, how much money have you guys raised?
It's about 360-ish million.
Yes, Paul Kocher still has a checkbook, amazingly, after all this time. So, all right, wonderful. So you guys are in the employer prevention and wellness category. Why there isn't an employer prevention category and employer wellness category, I don't know, because it's for consumers, but I was kind of kidding around with my friends at Mark and Melissa and the team about that. But let's dive into this issue about, there are two things, and one I pre-prepped, we'll start with that one. The other one I haven't, which is the sort of the how employers are buying question. But let's start with the question about ROI and what do you have to prove. Paul, I know that, I'll start with you just because I know that, and these are 30 to 45-second answers each, please. But I know the Virta's really dug into the data on this and you've just done a 5-year trial about it. How much do you think the employers care about this ROI data and all the rest of it? I know you want to preface this by saying that, Livongo grew super fast with not really a lot of data and ROI behind it. And there are companies that have done a lot of ROI work and don't seem to have got so far. So how much does it matter?
Well, I mean, first of all, it matters a ton. And if you're in metabolic health, people do care, and they absolutely should care, as people I think here very well know. It costs a lot for people with a metabolic condition, so about between 15 and 20K per year. So you absolutely have to care about value and proof for that matter. You mentioned Al Lewis, incidentally. He put up $100,000 of his own money, guaranteeing that we deliver the most savings in any disease category. So it's really important to us to show the value. I mentioned earlier, we deliver around 10K savings per person per year over a 2-year period. You mentioned the rigor we have. We've got nearly a dozen peer-reviewed papers at this point. We've shared outcomes out to 5 years. We've got our claims-based methodology validated by third-party actuaries. So it's this level of rigor that then enables us to actually put our fees at risk. And so the bottom line is we feel very strongly you've got to prove the value and you've got to make it transparent and as simple as possible for the payers to see it.
So if there's a tough crowd of people with diabetes, it's people with addictions. So how do you feel about this? The whole ROI, you've got to show it works to me.
Yeah, I wholeheartedly agree with Paul. And when you're selling to employers, I always think of it as being sort of two classes of benefits. There's the stuff that's going to help you attract new talent to an organization, and people will invest in them. And they don't necessarily need to deliver a great ROI. It's more about experience. And then there's the programs where you're actually looking for hard dollar cost savings and you still need to deliver a great experience on top of that. So I don't think experience and ROI are mutually exclusive. We've taken exactly the same approach as Virta. They're a company I admire a ton. And as a clinician, for me, quite frankly, I'm not a fan of blind trust. That's something works. I trust in randomized controlled trials and the peer review process. So we've also validated our clinical outcomes in almost a dozen peer review studies, including a 530-person randomized controlled trial that's following people over the period of 12 months. And then we've again validated our economic ROI by having third-party actuaries validate our sort of claims-based methodology and show that we're actually able to deliver this 3-to-1 financial return. I think when it comes down to it, from my perspective, the reason we sell to employers and the reason we have this B2B2C business model is because we just strongly believe that great addiction care isn't just the right thing to do, but it's also the right business decision, and it will deliver that hard ROI, not to mention all the other things we know about productivity, retention, workplace safety, etc.
Are you hearing more about demands of ROI for employers now than you did when you started? Or is it, I mean, were you doing this being morally pure because you have an MD and, went to medical school? Or, is this something you hear in the market really demanding?
I'd say that the market is increasingly demanding it. There's obviously the current times, macroeconomic uncertainty. We've seen that employers have raised the bar on expectations, and also they've just been promised ROI for a number of years from a number of point solutions that haven't really delivered. So they're looking at things with greater scrutiny. I think that the adoption of value-based care is actually going to accelerate, although we haven't historically seen that in the past, but it's got to, so that employers can look for where the value actually is in these different point solutions, and we need to be ready for that. And it's not something you can magic overnight. It takes years of work and investments in the right infrastructure to actually get there.
So Chris, you said something interesting there about the experience and making stuff better and making a more attractive thing. And I think a lot of what Maven and a lot of other the companies who've got particularly after women's health have gone down that path first, and probably thought more about that than the sort of the various ROIs and stuff, and saving cross money. But you are also a primary care provider. So how does that balance out, and what do your employer clients think about that?
Yeah, no, it's a great question. And I think, to echo some of what's said, in that the experience and ROI are not mutually exclusive things. And Maven started as a B2C company, and building for that end consumer is deeply into our DNA and is core with how we engage members. And, we think that we only earn the privilege of impacting the health of our members if we deliver a product that they love to engage with and continue to come back to time and time again. And so, we are very focused on the clinical ROI of our offerings, and focused on finding those right intervention points where we can make the most meaningful difference. And we do see things like a 28% reduction in NICU admissions, 30% reduction in unnecessary ED department visits, 20% reductions in C-sections. There's a lot of that we can prove out, and we work closely with our health plan partners. We're working through the claims-based studies ourselves, to make sure that all of that rigor is being applied. But our employer clients are also really focused on the business ROI. And there is a strong war for talent out there. I think when employers are offering things like financial support for fertility treatment, which has become something that's table stakes, clearly that is them making an additional investment because they believe it will pay off on the talent side. And that's where Maven's end-to-end model ensures that as they make investments like that, we are helping those individuals to have healthy pregnancies and return to work, and maximizing the overall impact that our employer partners can get from their investment in Maven.
You think that business ROI, I've got to hire people and I've got to do whatever it takes to get that and keep those, women of that certain generation in seats and all that kind of good stuff that we hear about on the obesity side, as well as on the sort of the infertility side and elsewhere. Do you think that goes away if the recession A shows up and B is pretty brutal?
I don't think it does. And with most of our employer clients, the war for talent continues, even with what you read in the news today. And what's been really exciting for us is just how mainstream these types of benefits have become, where, 5 years ago, when we were starting in the employer spaces, you would see the tech companies, the financial service companies, the usual characters you would expect. Today, we're serving retail clients, railroads, shipbuilders. And so I think we are just scratching the surface on the breadth of the employers that are really interested in having solutions like this, regardless of what happens next year with the economy.
Crossing my fingers, I grew up in the UK when unemployment was 13.5%, and I tried to get my first job then. And I don't remember anything really offering me anything, let alone a job, let alone benefits. So we'll see. Sarah, how does this play out to you? I mean, ROI, you know, making money for your clients. I mean, is it for just basically saying we're going to save you money on drugs costs and do it transparently, or what's the pitch?
With the skyrocketing cost of specialty medications, Matthew, there's a lot of emphasis on ROI. And so we are probably one of the few in the space who are willing to offer PMPM pricing and PMPM per member per month guarantees to our clients. When you think about utilization of prescriptions, you know, on average, 5 prescriptions per member, and with many specialty medications being at least $7,000 a dose, per month, there is a lot of emphasis in this area. I think the difficulty here is balancing that cost savings and delivering that ROI with the member experience. We know we've been able to save plans money who came across from other PBMs. In fact, we have a year-over-year savings of at least an average of 16%. But it's the member experience and the engagement that goes with it. And thankfully, we've been successful there with 100% implementation satisfaction scores, NPS scores of 96 compared to the industry average of 14. So it's really just a balance between the two.
Okay, great answer. All right, we have like a minute and a half left. I'm going to go to all 4 of you. Here's the big question. Employers have been told they have a gazillion point solutions coming at them. Here we have a clinic, a PBM, a diabetes management program, and an addiction management program. Do I want to buy all 4 of you separately? Do I want to buy one thing from Amazon or Mercer or Optum or someone? How does this end up? Play out. Do you guys all merge? Some of you go away. What happens? Let's go around, starting with you, Chris, then Yusuf, then Paul, then Sarah.
Yeah, so I think we've kind of from the outset known that breadth of what we can offer is what we need to have in the long run. And that's why we are not just focusing on one area. We have our family building solution, maternity, parenting, and pediatrics. When we expanded into menopause earlier this year, we're already covering 1 million lives and over 100 clients with menopause. So I think there's a lot of appetite to find that solution that can cover that full breadth of employees' journeys and minimize that point solution fatigue.
All right, so Maven at some point might even care about men, although they are irrelevant, let's face it. Okay, Yusuf.
I'd say that we've actually helped to join together a slightly fragmented ecosystem for addiction care, because historically, as an employee, you'd have a separate tobacco cessation program, maybe a separate EAP for alcohol, and then some PBM solution for opioid use disorder. And that hasn't really solved the underlying problem of SED or taken a very sort of member or patient-centric approach. Look, I think ultimately it's going to be dependent on the employer, but employers are going to want to solve what they see to be the highest cost conditions that affect a significant proportion of their population, which is exactly what addiction is, with that 1 in 6 people. How they contract with us, that we expect to change over time as well. Are they going to have direct contractors with half a dozen point solutions? Maybe not. Increasingly through our partnership with Express Scripts Digital Health Formulary and many health plans, national and regional, we've actually simplified that procurement process quite a bit. So now you don't actually need to directly contract with QuitGenius as a partner. It could be a service order through your health plan, through your PBM, through your benefit administration platform, and that actually makes it turnkey to implement.
All right, but the still thing is, it's expensive people. You're going to have the best solution with expensive people. Paul, 20 seconds, please.
Point solution fatigue is a real thing, but what outweighs that is employers getting a really critical problem solved. And so in the diabetes and metabolic space, there's nothing that's been able to solve that problem. And so if you can continue to show value, people are going to adopt your solution. That's what we've seen. We also, of course, help people reverse prediabetes and deal with weight loss and obesity as well. So that's half of the US population. So it's not like that's niche. However, the bottom line is you've got to show value, you've got to show outcomes. And that tends to overcome any issue with the fatigue issue you're talking about.
Thanks. Sarah, fatigue, point solutions, PBM's doing everything. What's up?
Yeah, so I think our secret answer here is Judy, short for adjudication, which is our cloud native platform that allows us to integrate with all of these point solutions. What I see a lot of is point solutions thrown at patients that's not cohesive with their benefit. So what's the point of someone being put on a GLP-1 medication if the insurance administrator does not cover it? Now you're putting the patient in the middle of this. What I think works is payers and PBMs working with these point solutions to offer an integrated offering to a patient that is effective and takes the work out of their hands.
Fantastic. That's a great answer. And the great idea is that it's only dealt with by somebody else and maybe it'll be capital RX. Fantastic.
Yeah,
All right. That was the employer prevention and wellness best in class, big established companies working in that area. You'll see the winner of this on November the 14th. And that is the end of that section. And we're on to our final section, which is the rising stars for this. So if you lot can turn off your cameras, everyone else turn on their cameras. We should have 8 of you in the rising star section. I hope I can see 4 so far, which is a good start. Any more coming? We should have another 4. We should have. So I'm missing anybody else? Okay. Anybody who's sticking the attendees who should be in this part. We're missing. Let me see. Missing here. We have Managing for Life, we have Tuned Care, we have Plethy, and we have Digbi. So we are missing Diagnostikare. Kumanu was, he was in the wrong section. The guy from the plane, Eric Zimmerman was the, so only 7. We're missing Tuned Care, Life Metric, and CancerAid.
Tuned is here. I'm here.
Sorry, you're there. Kate, you are there. We're not missing Tuned Care. I now have to try and look for 2 different screens to figure out, and that's too complicated. To figure out who's missing, that's too complicated for me. All right, well, I tell you what, we're going to go with who we have. And if anybody else shows up or is sitting in the attendee group and wants to come join us, please ping us separately. Let me know, ping Melissa, and we'll find you. So there should be 3 of you out there who we're missing, which is quite a large proportion, but that makes it more relaxed for the rest of us. Okay, so
Matt, sorry, this is Raphael from Diagnostikare. I'm here, but my camera is turned off by the host. Apologies for that.
Let me turn it on. Why can't I? Raphael from Diagnostikare, his camera is not working. Melissa, can you fix it for him?
I'd asked him to.
There he is. Well done. Okay, that's great. All right, so we are starting with Managing Life. So Raja, you have 60 seconds and go.
It's actually Thayer, John.
Sorry. You are
no problem.
Again.
So at Managing Life, we are dedicated to improving the lives of people who live with chronic pain. Chronic pain affects about 40% of the typical workforce and is the leading reason for medical absenteeism, disability, and long-term opioid use. And the way that we help people is through our digital solution called Manage My Pain. It's the top-ranked, most downloaded digital solution for chronic pain on the market, and the only one that has been clinically validated to improve outcomes. By helping people improve their pain, we lower absenteeism and disability rates for employers and plan sponsors.
Fantastic. Great overview there from Tahir of Managing Life. Sorry, I got that wrong. Okay, so next we are going to Digbi Health, which is Ranjan from Digbi or Digbi?
Digbi Health, Matt. Thank you, Matt. Good afternoon, everyone. I am Ranjan Sinha, founder and CEO of Digbi Health. We are a next generation care platform for chronic digestive and cardiometabolic illnesses. We use advanced diagnostics, gut microbiome, genetics, continuous glucose monitor to really design a personalized care that works for the person's unique biology and life circumstances. And we are a distinct departure from pretty much 99 of the 100 digital chronic care platform that have effectively digitized 30, 40-year-old science and care protocols. So we are really bringing some scientific innovation to care of digestive and cardiometabolic care.
All right. Now it is Raja's turn. I like your teacup.
Yeah, I'll go for it. Hi, I'm Raja Sundaram. I'm the CEO of Plethy. Plethy Recoup enables injured workers using biopsychosocial method to follow the care and recovery from their musculoskeletal conditions at home or on the go. The care team has real-time insights to intervene quicker and personalize care. We primarily work with carriers and self-insured enterprises in supporting their injured workers to return to work quicker through a healthier recovery. Thank you, Matt, for the opportunity.
Thanks so much. Okay, now back in order as we have Raphael from Diagnostikare.
Thank you. Hi, this is Rafael Lopez. I'm co-founder and director at Diagnostikare. We are basically an AI-driven virtual first primary care platform based out of Mexico, and we're providing a comprehensive care solution that's creating value for both employers and employees for as little as $2 a month per employee. We're actually changing the primary care landscape in Mexico and Latin America, where access to care remains a challenge for over 140 million people, let alone out-of-pocket expenses and the preventative care approach. So yeah, that's what we're doing, and thanks for having us here.
Excellent. And then last and definitely not least in this group is Kate from TuneCare.
Thanks, Matt. I appreciate it. Hi, everyone. I'm Kate McGinley, and I'm a co-founder and chief growth officer here at TuneCare. So today we all wear headsets for hours every day, oftentimes on calls just like this. At Tuned, we help employers who recognize the impact of this on employee hearing health, and we deliver the only hearing benefit that goes beyond just discounted hearing aids. We focus on preventative hearing care services, as well as conditions, beyond hearing loss, such as tinnitus, delivered all via telehealth. We have 180 doctors of audiology backed by a product marketplace that includes hearing augmentation software, apps, and lower cost OTC hearing products. In 2022, we delivered access to over 5.1 million working age people.
All right, so important, very important issue there, and one that I know has been picked up in Medicaid, and we have a little discussion about hearing aids and hearing loss. And if you talk to Charlotte Ye at AARP, I don't know if many of you know her, who's the medical director of AARP.
She's great.
Asked her once, what is the biggest problem in healthcare for your members? She said, it's hearing, which was not the answer I was expecting, but when she talks about it, certainly was. So it's amazing. So on that topic, and I'm going to go around you all out and just 30, 45 seconds each, so please keep your answers as brief as possible. But you're in the employer section, employer prevention and wellness section, and is that all of you your preferred channel, or do you think you end up in a different place? So we had this discussion about how do we sell stuff to whom. You're starting out, you're fairly young companies in general. How compared to the folks you just saw who will raise hundreds of millions of dollars, how are you going to get, is employers the right strategy, and or are there others? So I'll start with you, Ranjan.
So we currently definitely go through the employers, and what we are seeing is employers do find us as a distinctly different than the generation of digestive and cardiometabolic care programs before us. And as far as going directly to the consumer, I could never get comfortable with the high cost of acquisition, given we have hard cost of goods of the genetic gut microbiome and the CGM. And we are now announcing a partnership with a large lifestyle appliance company that will take us into the direct-to-consumer space, while we'll continue going directly with the employers. And we have signed some important partnerships, like with HTA as a certified partner. So I think I do see a distinct appetite for a program like ours that is different.
Fair enough. Let's go to here next.
Yeah, we actually started off as a direct-to-consumer app. I wanted to make sure that people with pain actually used our program before we actually approached any employers or doctors. Once we actually became the most downloaded, then we went to Canada's largest academic hospital and integrated into their clinical workflow to prove clinical outcomes. Now, armed with the evidence that people use it and it actually improves outcomes, now we're at that inflection point where we can go to payers, ultimately health plans, plan sponsors, employers, to show that our solution actually helps improve the outcomes for people in pain. And for employers specifically, that means reduced absenteeism due to chronic pain, reduced disability prevalence, as well as faster return to work.
I don't know how much you've looked into this in the US, but the comparison between, when you say payers, employers that want to pay, plans or others, obviously employers are getting stuff from each side. They're getting people coming direct, they're getting people coming through brokers like the Mercers of the world, and they're getting people going through their health plans and the things that are attached to their health plans, like Optum and others. Right. How do you balance the strategy of that?
I think because there are so many solutions, it's just trying to find the right channel to introduce our solution. It's a real pain point for employers. They're looking for chronic pain solutions beyond MSK. And we found that the health plans, by approaching their large accounts, is a great channel for us to meet those employers that are actively looking for solutions.
All right. Raphael, you want to take a little bit on how important employers are to you? If you're doing a fairly cheap program, maybe it can be done by consumers or direct through health system, national health systems, especially in Mexico. Want to tell me about your strategy?
Yeah, it's a bit of a challenge. I mean, the healthcare system in Mexico is quite fragmented. You've got several entities providing care at different levels, yet 2/3 of the population lack access to any sort of coverage, either private or public. And just 1 out of 10 people can say are covered by any sort of insurance. We always thought of employers as the right way to go for two main reasons. One, I mean, when we started for it was a matter of how do we get scale lots of patients and being able to actually study and understand our clients and our patients as a concentrated population and create bigger impact. Secondly, for us, it's a matter of aligning stakeholders. So people spend more than half of their time working for companies, whether remotely or directly at the workplace. And it's how do we align those stakeholders, being the employer, the wellness teams, for us to become basically their extended arm when it comes to making healthcare accessible for these thousands of people. I mean, it's we always thought about it. It's been great so far. I mean, we're working with some big names out there, the likes of McDonald's, other big names locally, but are seeing a lot of value in this approach by basically outsourcing the whole care delivery to us.
Interesting. Roger, in the MSK world and the, sort of the back pain and elsewhere, there are already some huge players. You're a rising star, but there are some really big players who raised a lot of money in this space, and we don't have to mention who they are, but some of them are named after things attached to doors. I guess one of the things is that employers have a lot of issues with MSK. Obviously, that happens, but in some of the other chronic conditions, perhaps are more for older people who are aged out of the workforce. Is that why you've picked on employers?
Yeah, we actually do both. In workers' comp, we come top down from employers because they have clinical indemnity cost. So you can't go in and say the employee was happy and they participated. They look for, did the human being return a day earlier back to work? It's binary. Either do it or you don't do it. We are very strong clinically. On the other side, in group health, we go down and through orthopedic groups, spine groups, pain clinics, physical therapy groups. So we are doing both. At the end of the day, we kind of see the meeting place to be the provider at all times, the care provider. But in workers' comp, it's easier for us to go through the person who owns the purse string, who wants the employee to return to work a day earlier, right? And that's really why we decided to focus on the self-insured, on the carriers on workers' comp.
All right. And Kate, what's your reaction to this concept of, why employers, you've got a thing which works for, hip loss. And again, we had somebody on the other panel who was talking about, early panel who was talking about that as a direct consumer play. So,
right. So I've been in healthcare for a long time. And
not
so
as long as I have. Just look at my hair.
Well, no, but I've dyed hair. Anyway, so we're partnering with plan sponsors and plan administrators to bring Tuned as a covered benefit to employees and their dependents, right? And one of the things that we see is that there's just an incredible stigma against hearing health. Everyone assumes it's for older people, and I think that's why direct to consumer is popular. But when you look at the data, 50 million employees already experience mild to moderate hearing loss, and 1 in 4 have some kind of ringing in the ears. So for us, it's great to have an improvement on hearing aids, but our users are in their 30s and 40s and 50s, and they're just grateful that their employer has recognized that old discount benefit is pretty marginalizing and not equitable, particularly for frontline employees.
Yeah, I wouldn't have thought about that. So you're basically identifying a problem that most people don't think about, and it's one of those things where, obviously there's a real repercussions, especially as I think, in my day, it was going to Motorhead and AC/DC concerts that, did your hearing back in the day. But now it's, kids listening to with gaming and what have gaming in headphones and listening all the time.
Mm-hmm.
Probably wrecks everyone's theory about something in their 30s and 40s. Absolutely. All right. Last set, we have like a couple of minutes to go here before we have to wrap. So real last part is, and I want to go back to this question of ROI and how much it matters. When you're a young company, I want 20 seconds each from you, don't go on. When you're a young company and you're trying to get into that, foot in the door and get going and, go back to those first few sales to really get it from being the PowerPoint with a prototype to actually being a real business and a real product line. What was it that made the difference? What was it that the employer you went to said, yeah, we'll give you a try because this sounds like something that makes a big difference that we're going to go on with? So what was it? We'll go around quickly. Start with you to here, just 20 seconds. What made the difference?
Yeah, I think clinical validation, it was a 3-year study, multi-site control trial showing that we have improved outcomes. But more importantly, over a 3-year project with RBC Insurance, people on disability who used our platform had a 7.5 month shorter disability claim duration. That's about 20 to 25.
ROI and return to work. Roger.
Clinical outcomes. People have seen a lot of wellness solutions or, the doorknob thing that you talked about. So they wanted something that actually works, that actually gets employees returning back, say from a knee problem 25 days earlier. It's binary. That's what we deliver.
Kate.
Yeah, so I mean, for us, we started with a fairly decently sized TPA out of the Midwest, and I'm big on data. So we collected that data and we were able to show, look, instead of spending $4,000 on a hearing aid, your employee just walked away for $150 and they've got the same clinical outcomes. So data is really part of what we do here at Tune, and we're very transparent with that consistently.
Raphael, what made the difference in those first few sales? How did McDonald's?
Yeah, so I'd say previous trials that we run in order to actually being able to demonstrate the impact that you create in employees by providing this sort of solution. I mean, bear in mind, it's a fairly new market for Mexico and Latin American countries. So that was another opportunity as well. The innovative, the high quality, low cost approach that we're taking, that's what has allowed us to put a fit in our companies, basically.
Fantastic. And for the very last word of what's been an incredibly intense session, Ranjan from Digbi.
I think we got a break by supporting members of Blue Shield of California. So we built a large data set, 5,000-6,000 people, that allowed us to publish multiple publications showing efficacy. And there is a natural tug we have seen among employer buyers about the innovation of genetics and microbiome, because it just appeals to everyone saying, wow, okay, what you're delivering for me is for my biology, for my unique physiology. So I think a combination of those two definitely made it easier. And every referenceable client builds on the next one.
Absolutely. It's all about telling the right story and having the right evidence to back it up, and having the right relationships, and having done good things for the people who come through your care. And I think, there's not enough of that in healthcare in general. So congrats to all of you for working on that as rising stars. So that was the rising stars category in employer prevention and wellness. And we are done with this webinar. I'm going to invite Melissa to come back if she wants to come back on screen. So you will see there are another 3 webinars. I was given the task of by far the most people to deal with. Thanks, Melissa. Thanks, Mark. Thanks, team at UCSF, for really dumping me in it. There are some with many, many fewer people. So the people in the next webinars will get a little more time to talk. We're expecting, but I think they are coming up in the next, when are they, Melissa? When are the next webinars?
We have one tomorrow at 11, and then next week as well on Tuesday and Wednesday, all at 11 Pacific.
Right, and that's the other categories. There are not a gazillion, there are a lot of categories in the UCSF Digital Health Awards. Maybe too many, I don't know. We can always discuss next year, but you'll see another bunch of rising star and best in class companies in those 3 other webinars. You have Daniel Kraft, Lisa Soonen, and Mark Goldstein will be running those ones individually. I don't know who's doing which, but you'll figure it out coming at 11. And then the whole thing, 6 p.m., as you can read behind me and behind Melissa, 6 p.m. at Health and Vegas at, where is it?
Is it the Zouk nightclub?
The Zouk nightclub. There we go. We'll see us in the Zouk nightclub. Are we serving alcohol and champagne during the awards?
There will be appetizers.
What about the guys on stage? You get extra?
We'll work that out.
All right. Well, I will let you take us out of here, Melissa. Thanks for inviting me to have this. Thanks to everybody on the webinar across the board, all sections, for keeping the time, for doing, for figuring it out, doing a job and not monopolizing. And look forward to seeing everybody in Vegas.
Awesome. Thank you, everyone. Thank you, everyone, for attending and sharing your thoughts and comments, especially to Matthew for keeping everybody on track and getting through all of your companies in literally 90 minutes on the dot. We appreciate that. Thank you to all of our attendees who are able to join us today. Well, this session was recorded, and so we will share it out via email as well as on our website and social media. So if you weren't able to stick around for the whole thing, it will be up. And as Matthew said, we will have more sessions tomorrow at 11 and then next week on Tuesday and Wednesday as well. And I look forward to seeing you all in person at our grand finale on November 14th.